At Dartmouth-Hitchcock, staff are likely to encounter two types of dogs: volunteer pet therapy dogs and service dogs. Volunteer pet therapy dogs and their handlers offer support to patients, visitors, and staff, while service dogs focus solely on the person they are trained to serve. This video is designed to help Dartmouth-Hitchcock staff learn how to recognize volunteer pet therapy teams and service dogs, and learn how and when to respectfully intervene to ensure the health and safety of everyone in our shared environment. Volunteer pet therapy teams are easily identifiable as the handler wears a red apron and the dog wears a red bandana. Notice both also display DHID badges, as both the handler and the dog are volunteers of Dartmouth-Hitchcock and have proven they are up to date on their immunizations and are familiar with DH policies and procedures. Unlike volunteer pet therapy teams, service dogs are not required to wear any identifying badge or harness and may appear to be a personal pet at first glance. It is important to note that persons with service dogs are not required to carry any form of certification with them, and that it is against federal law to ask a person what their disability is or to ask them to produce evidence of their disability. Service dogs are valuable, federally protected, and often necessary resources for persons with disabilities. While Dartmouth-Hitchcock is committed to ensuring persons with disabilities are offered equitable access to care, there are some areas of the hospital where the presence of a service dog or any other animal can compromise the safety and health of other patients, families, and staff. For this reason, dogs are generally not permitted in medication and food preparation areas, medication storage areas, clean or sterile supply areas, or clinical areas that require a sterile environment like operating or recovery rooms. Dogs are also generally not permitted in expanded precaution rooms or immunocompromised patient rooms or service areas, such as the intensive care unit and emergency department. If you see a dog in the hospital and are unsure whether or not it is a service dog, the best thing to do is to observe how the person and dog are interacting with each other in their environment. Intervention is only needed if the dog is posing a direct threat to the health, safety, and well-being of others. If further support is needed for the intervention, staff should notify their supervisor and call security. If a dog is demonstrating disruptive behaviors like barking, growling, soiling, or frightening nearby people, or if the dog and handler are attempting to enter an area that is of restricted access to animals, staff are encouraged to respectfully intervene and share why the intervention is necessary. For example, "I'm sorry to intrude, however, we're unfortunately unable to allow or accommodate service dogs in this particular area, as many of our patients are at increased risk of infection, and the presence of the animal may cause them harm." By understanding the importance of service dogs and volunteer pet therapy teams and recognizing the limitations, every DH team member can help ensure Dartmouth-Hitchcock remains a welcoming and safe environment of equal access for all persons and abilities.